Welcome to this Facebook Live, everyone. I'm Kara Sundlin, and I am joined by Dr. Akiko Iwasaki of Yale University, who has just joined a task force that is charged with helping contain the coronavirus, specifically here in Connecticut. Welcome, Doctor. Thank you so much for being with us.
Thank you very much, Kara, for having me.
So there's so much confusion, and we're so happy to have you here because you are an immunologist, and so explain what you're specifically studying with regards to this virus.
Right. So I'm an immunologist. That means we study immune response to viruses. And this is a new virus, coronavirus, COVID-19. And so we don't know very much about how the immune system responds to this new virus. But we need that information in order to develop a vaccine or therapeutics. So my task is to provide an insight from the immunological standpoint on how we can contain and control and develop therapeutics against this virus.
So I'm inviting everyone to post their questions on the Facebook Live. I'm going to ask as many of them as I can to the doctor. And please share this with your friends because I had the opportunity to speak with the doctor off camera, and there's a lot of information, new information that I didn't realize that we're going to be sharing on this Facebook Live. So I think it's going to be worth your time. Number one, I know we're trying to quell fear, and that's something that the media has been accused of, raising fears. No, we're, at least here, we're really trying to tell people, wash your hands. Lots of people have been recovering from it. Those are all true things, but from your perspective, you think we need to be doing more. The government actually needs to be acting in stronger ways to protect people from an outbreak. What do you mean?
Yes, absolutely. I think we should be doing more. For instance, this virus is predicted to infect up to 100 million people if we don't do anything about it. And also, this prediction, is predicting that 1.9 million ICU beds are required to deal with the people who are getting very sick from this virus in this country if we don't do anything about it.
In this country, you're talking about almost 2 million people only in the United States.
That's right.
And what happened in China, the United States is a very different culture, but what happened in China with the very strict quarantines, you say actually helped.
Yes.
That's why their virus peaked and is now going down.
Exactly. So they took a very drastic measure of quarantining, many millions of people, and that had the effect of slowing down the spread of the virus and the government being able to take care of the existing virus and to prevent the spread of the virus throughout the world. However, we don't have that kind of quarantine system in this country. And so the best we can be doing is to prevent the spread by social distancing.
And we've been hearing that term, it's a new term. If you haven't heard it, it's been in the news a lot, social distancing. What does that mean and why is it so important that we do that?
So social distancing will prevent the number of cases from rising rapidly. And what that allows us to do is to control the epidemic and to for the hospitals to be able to deal with the number of patients that are coming on with this virus. Right now, the hospitals are not ready to take on, millions of people coming through to the ICU, as I mentioned before. So what we need to do is to reduce the number of spread, as well as reduce, even if it prolongs the spread of the virus, so that
reduce the number of people getting it. And what specifically, so if you're watching at home and you're worried about your family and you're worried about people going to work and all that, what do you recommend if you got to break the rules as an immunologist? What would you tell people of Connecticut to do?
Right. So we really need to be avoiding mass gatherings.
Mass gatherings.
Because those are the places in which the virus can transmit from one person to another very quickly. And so any large conferences or symposium or...
what about outdoor events? Like I'm thinking the St. Patrick's Day Parade is coming up on Saturday.
That's right.
Is it safer if you're outdoors or...?
Unfortunately, the outdoors doesn't guarantee that you don't get transmission at all. In fact, if you touch the surface that somebody else who's infected touches, and then you touch your face with that hand, that's how transmission can spread. So it doesn't matter if you're inside or outside. The important thing is to avoid large gatherings. And so the Yale University came out with the recommendation to cancel or postpone gatherings that are over 100 people.
And I noticed that the Organization of Connecticut Colleges and Universities also has been putting that out there. So I imagine other schools are going to follow suit. But life goes on for most people, right? Most people have to go to work and go to school. In China, they actually, most people were ordered to stay home. Is that right?
That's correct. Yeah.
Even if they had no signs or symptoms.
That's correct, and that's very important because it is very important to prevent the transmission from an infected person to another. And because this virus has an incubation period of up to 14 days without symptoms, you don't know if one is carrying the virus because you don't feel sick.
Can someone transmit it if they're not feeling sick?
Yes, you can transmit the virus even without feeling sick. And so, even though you might think you're well, you could be infected with this virus.
So we should let people know that I just did a story on the news that 80% of people have been recovering just fine, and many without any intervention at all.
That's right.
That those numbers are accurate.
Yeah, those numbers are accurate.
The concern is about the other 20%.
Exactly. The other 20% could get severely ill, especially people who are older, or people who have immunocompromised status, or people who have existing diseases like heart disease or lung disease or asthma. And so those people, it's very difficult to recover from this virus, and some of them end up in intensive care units.
So if you think, what are the symptoms? Because this is cold and flu season too. And we've had that experience with just even people here in our own office when you see someone sneeze or cough, people wondering, what are the symptoms of coronavirus?
Yeah, so that's the one thing that's very difficult because the coronavirus symptoms are very similar to the flu. So you would have fever, cough, and shortness of breath. And these are all, some symptoms that flu patients would also get. And so the only way to know if you have a coronavirus is to be tested for it.
And the problem is we haven't had enough testing. And this is something you say, really, the CDC should have had more tests and gotten them out sooner.
Exactly.
I know that Senator Blumenthal has asked for 1 million tests for Connecticut. I think we got another 600 today.
That's right. We are nowhere near testing enough people for the coronavirus. And so, there are people on the wait list right now trying to get tested for the coronavirus, but the kits were only made available, very recently. And so some of us laboratory researchers are developing our own tests in order to be able to catch up with the surveillance of this virus.
So I'm just seeing some different questions that people are saying. I feel that people have respiratory issues, can be severely ill or immunocompromised. Yes, that's exactly your concern. Another one asks, Kelly asks, how long does it last without interventions? And this is important to know because if you get the flu and it's really bad, they might give you Tamiflu. There is no intervention like that for coronavirus. Is that correct?
That's correct. Right now, there is no approved way of treating this coronavirus. So Tamiflu or antibiotics that are used for other infections do not work for this virus.
So what would you advise, even let's say you're a mom at home, you're watching this Facebook Live and your kids go to school. Are you thinking that actually Connecticut should be preparing for distance learning?
Yeah, that would be ideal. In fact, schools and large gatherings like this is really where the virus can spread most effectively. So distance learning, distance working from home, if possible, and especially if you have any of these symptoms or if you have any of these existing conditions, it is very, very recommended that you stay home.
Is it fair to say that doctors really don't know enough about this virus yet?
Yeah. Oh, yes. Nobody knows enough about this virus yet. It only began spreading, in December of last year. So we're learning on a day-to-day basis what this virus does and how it transmits and, what we can do to prevent the virus.
So there's a lot of fear out there, and hopefully when we're doing these Facebook Lives, part of our goal is to quell some of that fear, but make people smart. What can people do? People hear, hand washing, but that's actually quite effective, right? You can't stress that enough. Just
exactly.
Washing our hands, even if hand sanitizer is sold out in a lot of places, washing our hands is a very effective protection.
Absolutely. Washing hands for at least 20 seconds is more effective than hand sanitizers.
Okay, so hand sanitizers, we should only use them if you have no other choice.
Exactly.
You're in some public place and
That's
you're worried
right.
and there's no bathroom around. Otherwise, warm soapy water for at least 20 seconds.
Exactly. That's a very good thing to do. And again, social distancing measures are also going to help because then you prevent the spread altogether.
So right now, if you're just joining us on this Facebook Live, we are here with a doctor who is on the task force for the coronavirus in Connecticut. And if you're joining us, we are here with Dr. Akiko Iwasaki. She has her doctorate in immunology at Yale University. So you're letting us know about how this can spread, what we need to do to protect ourselves. And at the same time, you don't want people to panic. It's just, if we're not smart about it, the virus could actually spread much faster and to many more people.
Exactly. So there's no need to panic, but we need to be realistic about the capability of this virus spreading throughout the population.
Why is it spreading so rapidly? Is it much more contagious than the flu?
It's expected to be much more contagious than the flu, maybe twice or three times as much.
Okay.
And also, because we don't have any existing immune response against this virus, we are all naive, meaning that we don't have any antibodies or any way to fight against this virus. Most of us had flu vaccines or flu in the past, which has, existing immune response. Whereas for this coronavirus, because it's so new, we don't have any existing immune response.
So we've been reporting, and it's been by many outlets, that for whatever reason, even in China, fewer children got the virus. It was really more adults.
Yeah, that's correct.
Why? That's a good thing, but why are children faring better?
Yeah, that's a really great question. We don't know why they're doing better with this virus, because in the case of flu, children are actually very susceptible to diseases.
They're higher risk.
That's right. So that's a big scientific question we don't know the answer to.
So what are the early symptoms of coronavirus? And I know we talked about this a little bit, but people are joining the feed more now. And when should you be seeking professional evaluation or asking for one of these tests?
Absolutely. So having a fever and cough and shortness of breath is a typical sign of this virus. However, if you've been in contact with someone from one of the countries with a high number of outbreaks, or you've been traveling to these kinds of places, this is something that, and you're developing fever, you really need to contact your health provider to see if you can be tested.
If you don't have a fever, is it likely you don't have coronavirus?
Well, again, we don't know, but because there's an incubation period.
Yeah.
So there's no guarantee that just because you don't have fever, you don't have the virus.
Okay. And you did say before that distinguishing between the flu and the coronavirus is really something that can only be done with testing.
That's correct.
But if you have the common cold where you don't have a lot of aches and you're just kind of a runny nose, do you still then ask to be tested?
Probably not, but you should stay home. Because you can still spread that to other people.
Right.
And so with the common cold, you usually have runny nose and very low fever, if any. It's a very different kind of symptom than what you would get with the coronavirus.
And how are people infected? Like, what if someone's not sneezing or coughing? Could you still be infected by them?
Oh, yeah. Like I said, this transmission by touching surfaces that are contaminated.
So this person touches the table and the virus lives on the table for, do we know how long? Is it hours? Is it days?
It could be up to days.
Days. So that's why we just don't know. They say, oh, I haven't been around anyone.
That's right.
But if you happen to touch an escalator or touch even your friend's coffee table, it can live.
That's
so
why
wiping down surfaces?
It's very important to clean the surface with, to decontaminate. Especially in places where people touch a lot, the doorknobs or, computer keyboards. If they're being shared by others, that's where the virus lives.
And we do have on the Ch.3 app a list of approved cleaners by the CDC, because I know a lot of us are into cleaning more naturally, but I noticed those products are not on the list. It tends to be more Lysol, bleach, harsher cleaners that the government is saying is okay to actually kill the virus, versus maybe if you're using something supernatural.
Exactly.
What about face masks? This has been a big issue. I know the Surgeon General had said he doesn't want people wearing face masks. It's not helping. It could actually make it worse.
Yeah. Well, face masks are not recommended right now in this country. And the other issue is that, the healthcare providers, where they really need the face masks, there's a shortage of face masks by people, buying these things and stocking them in their homes. And it's really not necessary to do that right now. It's much more important that you wash your hands.
So how many times a day are you washing your hands?
A lot.
A lot? All the time? Okay. So we can't be washing our hands too much.
That's correct.
Okay. And what if people have travel plans? This has been a big thing. You know, people have, some of the airlines have, if you have tickets to Italy or a place that's been named as a high threat zone, people are getting refunds. But people are concerned about maybe losing their plans, losing their funds. If they're just traveling either within the United States or to some place that isn't known to have the coronavirus. What's your advice to people who have travel plans?
Yeah, it's a very difficult time because people have had plans for spring break, and you know, it's a fun time of the year. But unfortunately, because of the coronavirus outbreak, I would recommend, if you don't have to travel, don't travel.
So that means if you're just planning to go away to Disney World with the family,
no.
No.
I would recommend against any mass gatherings such as
For how
that.
long? How long do you think this is going to go on for?
Oh, who knows? I mean, it could go on for months. We don't know. It's a new virus. It's very difficult to predict, especially in a country like this where the growth is exponential at this point.
And talk about the growth. What can we expect? We have 3 cases as of this conversation that we know of in Connecticut right now. Many more people are being tested. What do you predict in the coming days and weeks, even months, for Connecticut and our surrounding area?
Right. Well, you know, because the state of New York having so many cases and we're adjacent to New York, I would think that there's going to be hundreds, if not thousands, that are going to be tested positive. And I wouldn't be surprised.
So you wouldn't be surprised if schools get shut down?
Yes, I wouldn't be surprised. Yeah.
And in fact, today we did report that Cromwell, maybe other schools are going to be doing this, took some time off because they want to start studying distance learning. That was something that was employed a lot in China, right? Kids did not go to school and everything was online.
That's right.
It's a big problem for parents, right? Because you can't leave the kids home by themselves.
Yeah. So this is going to affect everyone, you know, from kids to elderly in different ways. And one of the things that, you know, we have to be prepared for is how do we take care of children? You know, if you're working and if both parents are working, how do we get work done in that situation? And again, if anything can be done remotely, that would be the best way to do it, even from home.
So there are people who say, I'm scared, I have asthma, I have respiratory issues. Is there anything you can say to those people, perhaps, so they can just feel a little bit better about having some control and some ways to keep themselves safe?
That's right. So avoiding a large crowd, I keep saying this, but it's very important, and washing hands, and also standing away from people who are, you know, coughing or, you know, in the public, 6 feet or more. This is the distance that are required to prevent transmission from the airborne virus. But really the best thing, if possible, is to stay home and work remotely. And if not possible, take these measures that I just mentioned.
What about doctor's appointments, dental offices? A question's coming from Melissa, like, should you not go to your doctor appointment? Should you not go to your dentist?
I think you need to go to your doctor and dentist, you know, if this is necessary. But again, those places aren't going to be filled with hundreds of people unless you're going to the hospital. And so, you know, the hospital's going to have a surge also from people who are getting flu and coronavirus and many other sort of seasonal infections. And so the best thing to do if you're not severely sick is to stay home and call your primary doctor to find out what is the best course of action.
Kelly Sunflowers asks, how long does it last? For example, when would a person be well enough for work? Usually a week, a month, days?
Again, it depends on the person. Some people don't feel much from getting infected with this virus, whereas others go into severe disease and need to be hospitalized. So depends on the person, and even a healthy young person can end up in ICU. So I cannot really predict for any given person what would be the course.
Okay. This is a question that actually is one of the most asked questions, I guess, on the internet. So I'll ask it. If infected with coronavirus, can you survive it and recover? The answer is yes. We've seen about 80% of people, and some might have a very light case, and is it possible you might not even know you have it?
Exactly. So people have asymptomatic infection, meaning that they don't even know they're infected, but they can still transmit to others.
Okay.
Yeah.
What about pregnant women?
Yeah, it's a very good question. We have very few number of cases in order to predict what would happen. Women who have been studying in China, who were in their 3rd trimesters, they delivered the baby and they seem to not have transmitted the virus from the mother to the child.
Okay.
However, there may be long-term consequences. We don't know. We just don't. It's too early to say anything. We also don't know what happens to mothers who are infected at earlier stages, first and second trimester. Because the outbreak is so young, it's hard to predict what would happen in those cases.
Can we eat out?
I think you should. I mean, again, as long as it's not going to be this is something that we need to, prevent the spread, but without becoming too paranoid about things. Again, wash your hands.
Viruses are usually, if you order something that's very cooked and perhaps even heated up again in your microwave, is it true that then most of the time viruses are killed when we heat the food very?
That's right. So I'm not too concerned about getting the virus from the food that you eat, but it's more like the doorknob that you touch or people who are coughing next to your table.
Okay.
This kind of issue.
Lots of people are asking, so I'm just going to ask the question again. What are the symptoms?
Okay. Symptoms include fever, cough, and shortness of breath.
What kind of a fever?
If you have a fever above 101, that's something to be concerned about.
Okay. And it could, again, if you're just joining the feed, and I'm repeating because different people are joining at different times, if it could also just be the regular flu. And the only way to really determine, because these symptoms are so similar, is the actual test.
That's correct.
Okay. Now, people are saying, should we not leave our house? You're not saying people shouldn't leave their house, but when you say don't go to an area where there are a lot of people, does that mean don't go to the grocery store? Does that mean, could you define it a little bit more about what you would practice for your own family?
That's right. So as I mentioned at Yale, they're already canceling seminars and conferences that have more than 100 attendees. So that's what I mean by large gatherings. If you have hundreds of people gathered in a confined room for all day.
What if it's just a place that hundreds of people go to, like the grocery store or the bus stop? Or
well, you do have to carry out your life still.
Yes,
You cannot be starving at home and hiding. I mean, that's not what I'm recommending, but just exercise caution, right?
Yeah.
Don't definitely wash your hands every time you come home from a grocery store, and just be kind of mindful about whether people are coughing and, covering your cough with your elbow instead of your hand. And
no more handshaking.
No more handshaking.
I know a lot of doctors, it's very hard because I want to go up and hug someone, or we have to watch ourselves, but I did notice at Hartford Hospital, and also the Department of Health Commissioner said we have to stop touching each other.
Exactly.
No more. And now people are doing the Corona bump, or just clasp your hands, right? They say, okay, it's so nice to see you. And you can still emit some warmth to someone by being careful, because it's really not advised for us. Now, what about within your own family? Obviously, it's a little bit different if you're cuddling with your kids. I don't think you're advising people to stop doing that.
That's right. I mean, that's very hard not to do as a parent. But what I tell my children is that as soon as they step in the door, they've got to go to the bathroom and wash their hands.
Right when you come in the house.
Right when you come in the house.
You never know what you're bringing into the house.
Don't touch anything. Just go straight to the bathroom, wash your hands.
And I know that was the case. I remember my kids were in preschool. That was often a rule. The kids, before they could go to their desks in the morning, had to wash their hands.
Exactly.
I mean, there is a concern because a lot of parents are leaving their kids at daycare or schools or things like that. And all we can hope for is that you teach them good hygiene and that they're wiping down surfaces. I know a lot of superintendents have been communicating that on the weekends. They've been sanitizing desks, hallways, things like that.
Right, exactly. No, that's a very good thing to do.
If you're going to work, should you have your own wipes? Wipe your desk surface down before you sit down? I mean, what would be some basic things besides hand washing we should all be doing?
That's right. So I have a spray in my office where I just spray down.
Just a Lysol spray type thing?
And every time there's a new visitor, I sort of spray down.
Okay. Because you're an immunologist, so you know how this works. And,
exactly.
And that's something that you wanted us to understand, is that it's not so much that it's airborne, but that viruses do live for a very long time on surfaces.
That's right. And it is airborne as well. Like if somebody's coughing or sneezing, this does get into the droplet.
It does get into okay, so originally I think in the first few days the CDC said it's not airborne, and then do you mean, but what if you just happen to be in a hotel and it's in the air conditioning system? Or a lot of people ask, what about traveling on a plane? Is it safe to travel on a plane because of that enclosed air? That's
right. Traveling on the plane is a very difficult thing, because not only do you have a closed air system where, if a person coughs, 2 seats above you, you could still be getting that air.
Right.
And also touching, as well as like our own study found that a low humidity will prevent your ability to clear the virus from the respiratory tract. So airplanes have very low humidity, like 10%.
Okay.
And if you're on a long-haul flight for 10 hours at 10% humidity and having circulating air that you're sharing with all the passengers, that could be really bad.
If I had to just read between the lines, you would not be going on a plane right now.
Exactly. Yes, I've canceled all my flights.
You have. Okay.
Yes.
So if you're wondering at home, what do I do? The State Department just advised all Americans not to go on any cruise ships. Cruise ships are posing, it seems like, an even extra level of hazard for people. Is that because of all the close quarters?
Oh yeah, cruise ships right now is a really bad idea. As you know, there are many cruise ships on which the coronavirus has already been spreading, and
Yes.
it's very difficult to prevent that transmission on a cruise because everybody's sharing all the surfaces.
Right. And I think people are very concerned, especially in the sandwich generation, if you have elderly parents and perhaps they're living in a retirement home or a nursing home, or what should we be thinking of for them, because they are part of that high-risk group of
Exactly.
if perhaps coronavirus shows up in one of those retirement facilities.
That's right.
Is that a high risk then for all the people who live there?
That's right, and that's exactly what happened in the state of Washington, where transmission in nursing homes and things like that would really result in high morbidity. And so in Connecticut, what we should be doing is to, first of all, if you're not feeling well, don't visit your elderly relatives in nursing homes and any place of care like this, because they're much more vulnerable to this infection.
Okay.
So yeah, if you're not feeling well, please don't visit.
Well, I know a lot of times the socialization is an important part of living in those places. They all have lunch and meals together.
Exactly.
If you have an elderly relative who's compromised, would you advise them to get their lunch more in their own room and not be going to the group lunches with so many?
I wouldn't advise that yet. I think the most important thing is to prevent the outsiders from bringing in this virus or the flu, the same thing, because the elderly are also susceptible to flu infection.
A lot of people are saying that, oh, it's hype and people are spreading. And I think, I've really tried, and I think people here have also tried to be like, let's just give the facts. But you said, in fact, that from your perspective, it's more dangerous than the flu.
Oh, it's more dangerous than the flu. It is much more lethal. It's very contagious. And the fact that we haven't been testing people, we just don't know the extent to which this virus has already spread. And the number will continue to rise. And so, yeah, don't panic, but we need to be realistic.
Okay. Can the coronavirus go through the skin and into your body?
Unlikely. It's mostly mucosal surface. So eye, the nose, the mouth, the lung, anything that sort of, has a mucous membrane can transmit this virus.
Another question that people have, if a coronavirus patient does progress to pneumonia, what antibiotics, if any, have proven to be effective?
There is no antibiotics that's effective. So antibiotics are great for certain kinds of bacteria. But this is a virus.
So there's no antibiotic, and you had said that earlier. Right now, if you do end up with the coronavirus, they're just going to probably give you fluids, monitor you. There isn't an antiviral. Even like with the flu, they might give you Tamiflu. There's nothing like that for coronavirus at this time.
Unfortunately not. There are many companies that are testing, their drugs in clinical trials for antiviral therapeutics. And I suspect that those are going to become available soon. But right now, as this moment, there isn't an approved and effective measure against coronavirus.
I'm just checking to see some of the other comments that people are giving us on our Facebook Live right now. What about our pets? Can it get passed through them, or could you give it to your pets?
So there's been a couple of reports that a pet dog has gotten this virus, but I don't think they're a source of transmission from pet to human. Okay. But you've seen pictures likely of dogs wearing masks in Asia.
In Asia? Yeah. Well, in Asia you see a lot of face masks, and I have noticed members of the Asian community at Costco and places like that wearing face masks. So
That's
it is
right.
something that has been much more prevalent over there.
Exactly. And it's also like even without the coronavirus, Asian cultures tend to promote wearing masks on a sort of regular basis, right? If you're not feeling well or if you're afraid of catching something, they tend to put on masks.
Okay, and the
more.
difficulty right now is that those masks are hard to come by.
Exactly.
And there's price gouging going on Amazon.
Exactly.
So I know that, and you said that earlier too, if there's any question about face masks, the Surgeon General has said that unless you're sick, you don't really need it. It's more if you are sick to give it, not to give it to someone else.
Exactly.
But we're not advised to be walking around in face masks right now.
Not right now.
Not right now. So after recovering from the coronavirus, does the recovered patient have immunity to the virus?
That's a really good question. For this particular coronavirus, because it's still very early, we don't know if a person can develop a lifelong immunity to the virus. In fact, we may not. There are some cases of people getting either, reinfected or recurrent viral infections. So still very early stage, and that's why we need to study the immune response to this virus so we can develop a better method.
They are asking about the St. Patrick's Day parades, and viewers are writing in saying, do you think the parades should be canceled?
I think the parade should be canceled.
Because and can you say why?
Because of the fact that thousands of people are going to gather in the same place, and at this point, what we need to be doing is to reduce congregation en masse to avoid spreading of the virus. That's why I think it's a bad idea.
Okay, and March Madness is coming up. Lots of people have tickets to big basketball games.
Exactly.
I imagine your opinion would be the same about that.
Exactly. Unfortunately, these are really fun events. People are looking forward to it. It's a very good for business and everything. But at this point, I think we need to take this seriously and cancel these mass gatherings if possible.
And just so that people understand why, it's not that you think everyone's going to die from the coronavirus.
No.
It's that from your perspective as an immunologist that we need to worry about containing it so it doesn't spread.
Exactly.
Because the numbers that are being predicted, if we don't work to quarantine and contain the way Asia did,
that's right,
you could have huge numbers here.
Huge numbers, exactly. And the fact that if there is a surge in the number of patients rapidly in this country, the hospitals are not equipped to deal with such number of people. So we're going to have people who are sick from other diseases not being cared for because of the surge in the number of patients.
Tell us about the task force that you have been put on and who's on this task force. I understand that plans are being made right now. The public isn't necessarily hearing about them yet, but there are doctors like yourself and healthcare workers planning quarantines, locations, next steps. Tell us about this task force.
So the task force is put together by the Yale Institute of Global Health, which is led by Dr. Saad Omar. And he and several others, so there's a representative, Dr. Albert Koh from the School of Public Health, and from the Yale New Haven Hospital, Dr. Murray Landry, and many of us are getting together to provide our insight and to come up with the plan. How would we deal with this outbreak? Where do we even place the patients? How do we survey for these outbreaks in the community? Because right now the tests are so limited and precious that we're only targeting people who are severely ill, who are in the hospital, who are need to know.
We cannot test as many people as you think should be tested.
Exactly. Whereas other places like state of Washington, there are people who have developed in the laboratory, surveillance kits or the ability to test more than just the CDC mandated kits. So we're doing similar things. Can we develop a test so that we can survey and monitor the spread of this virus throughout Connecticut, for example?
People are asking about a vaccine. That would be a long way off, right?
Right. So the first vaccines are actually being tested in humans, clinical trial
already
right now. But as you say, it will take months until we know whether it's safe and efficacious. And so it's not, the first line measure right now. People are working hard on developing a vaccine, and I think ultimately that's going to prevent the spread of this virus in the future. But as of right now, we don't have a vaccine.
Others are asking, what about the movie theaters? Can we go to the movie theaters?
Yeah,
I think I
again,
would have gathered that you would not be going to the movie
that's
theater.
right. I would not be. I'll be watching some TV from home.
Okay, because you're just worried that that is,
Yeah.
again, a place where you would have more than 100 people, perhaps.
Exactly.
And that's our general rule of thumb from you, is that you don't think people should be going where there might be 100 people or more.
Yeah, and 100 people is just the recommendation by Yale University, but it doesn't guarantee that you're not going to get transmission if there was a 50 people meeting or 20 people meeting. It's just hard to predict.
Yeah. Priska just wrote, if I touch a surface, can I get it? And I know some people are joining the feed later on, and the answer is yes. You're saying that's
Yeah.
the big problem, is that
That's right.
this virus, if someone is sick and may not even know they have it,
That's right.
could live for hours, if not days, on a surface.
That's right. And then, that just by touching the surface, you're not guaranteed to get the virus. But if
when
you
we touch our face.
touch your face, exactly. So don't touch your face. I know it's very, you just.
I know, you're talking about touching my face, which made me touch my face.
I know it's very hard because everyone does this so
Yeah.
often, every day, and we don't think about it. But we really need to teach ourselves not to touch the face. Yeah.
So earlier, if you're just joining us earlier, the main point that you had, if there was just, if I could sum up what your concern is that you really don't think we're doing enough. I mean, we don't want people to panic.
That's right.
And that was another question. If I test positive for the virus, should I panic?
No, don't panic. You do need to call well, first of all, you would have called the doctor.
Yeah.
That's why you have a positive virus test. But by then, hopefully you're either in the hospital or getting self-quarantine or doing things to prevent the spread of this virus, as well as to care for yourself. By the time you know you're positive at this stage, you should be in close contact with the doctor in the hospital.
And if you have it, then if you were to test positive, ultimately your whole family would be tested positive. Or what if someone within your workplace tests positive?
Exactly.
Does that mean
Yeah.
you need to worry because you worked with that person?
That's right. So what needs to happen in a situation like this is contact tracing, which means that if a person tests positive, they need to trace who else has he or she has come in contact with in the last, let's say, 2 weeks.
Okay.
And then really start monitoring those people, even without sickness, just to see if they actually have the virus or not. And if they do, they need to self-quarantine.
How long will it take to find out? Because I know we don't have enough tests for everyone.
That's
so
right.
How long until you can figure out if you have the virus?
Exactly. That's why this task force is developing, different tests in order to be able to monitor those kinds of issues in the community.
I know that the governor put out a tip line. So if you have questions about the coronavirus, you're supposed to dial 211. And then if you think you might have it, if you're listening to this or you know someone has a high fever of over 100 degrees and they have aches and pains and feel like the flu, which is what the coronavirus would feel like, step one, they call their doctor, or where do they go to get a test?
That's right. So don't go to the hospital and demand a test right now. That's not how it works. You have to call the doctor.
Call your own personal.
Call your own personal
If you don't
doctor.
have a primary care,
Yeah.
then do you call the local
So
hospital?
I would, local hospital, or I would call that hotline, the 211,
Okay.
just to see whether they can refer you to someone
Okay.
who can really
Because we don't
monitor
want
this.
lots of people rushing to the
Yeah.
hospitals because we're worried that will create more
Exactly.
problems for the hospitals and everyone there.
Exactly, that's correct. So it's really important to, first contact your health provider and then explain the symptom. Have you had a contact with anyone, who has come from these high-risk countries, and have you traveled recently? All these questions have to be asked and to determine, if you're eligible for the test. Now, ultimately, in the future, we should have enough tests that, people who are suspecting that they have the virus can be tested. But
How
right
long
now,
are we going to have to worry about this? I know that's a crystal ball question,
Yeah.
but people are thinking, oh, well, I've got travel plans this summer. Right now, you're saying don't travel anywhere, don't go on a plane. But
Right.
what about by summer? Or do we just not know?
We just don't know. We could have this situation and worsen the situation for months to come. We just don't know.
In general, is there an arc for a virus? We saw that it peaked
Yeah.
in China and it's now gone down. And
That's right.
and that's attributed largely because they do have very strong quarantine measures. And
Exactly.
it'd be hard to do that here. But
That's right. So that's the very good question. Where is the inflection point? When are we going to see the virus go down in this country? Right now, we're nowhere near that point.
we still have to go way up before it would
Yeah,
peak and
that's
then start
right.
to go back down.
Exactly. So
Is it usually months for a virus? Is it years?
we don't know. It
Okay.
could be weeks and months.
Okay. that would be more typical, even though we don't know exactly about this virus.
Yeah.
Okay. Is there anything else you think is really important while we have people listening? I'm going to just double check the feed to see if there's any more questions. What about plane travel for spring break? And you have answered. I know some people are just joining. You're pretty against any kind of plane travel, even for short flights. People say, what about if it's a short flight? No flights from your perspective, right?
From my perspective, yes. Because, you know.
What about buses, trains?
Yeah, that's right. So if you don't have to travel, don't travel in general. Like even
if you need to take a bus to go to work,
exactly.
then that's different.
That's right. But again, if your workplace allows remote working, you know, if that's possible, that's something that I would advise.
Okay.
Yes.
I know if you're just tuning in, yes, you've already advised, and I feel the same way because we had plans for spring break, but no planes. Public transportation, you know, and really avoiding any place where there might be 100 people. And you did say also that if there are any government officials listening, you would advise canceling the St. Patrick's Day parades.
That's correct. Yeah.
Okay.
Unfortunately.
Anything else that you think people really need to know before we end this Facebook Live? And we're just going to double check to see if there's any more questions. But what will kill it? Well, we've talked about hand sanitizers, washing hands, spraying things, using bleach.
Yes, exactly. So yeah, it's very important to kill both the source of the virus, which is the surface, as well as avoiding coming in contact with people who are sick, like coughing and sneezing, and you know, and again, using your elbow instead of your hand.
No more handshaking.
No more handshaking. There's a recent a tweet that says that you could do a heart shake, which is something like this.
Someone asked, what about people who are under self-quarantine? Is there anyone really monitoring them? So to know that they're actually going to stay quarantined.
That's right.
I mean, what happens when you're in your house, you're quarantined, and the person runs out of milk or bread? Is there any stopping them from going to the grocery store because it's been 2 weeks and they just need to get out?
That's right. I mean, so yeah, I mean, it's very difficult to monitor everyone who's self-quarantined. We just rely on their goodwill, right, at this point, that they stay home and avoid the crowd. But of course, they need food, they need things,
and
they need medicines.
I know that the grocery delivery services, I was speaking to a manager at Amazon Fresh through Whole Foods, that they've been overwhelmed because people don't want to come to the grocery store. So people are doing more online ordering or getting more delivery of things.
That's right.
Is do you recommend that?
That's right. If you have to do self-quarantine, those are great things to do, is to deliver, get delivery of groceries and your medicine. You don't necessarily have to go to these stores. If you're in quarantine, you really can't do that. So.
Okay. What about just boosting your immune system yourself?
Exactly. So boosting your immune system is really key. Because for any viruses and pathogens. So getting enough sleep.
Sleep is key.
Very important. And washing hands all the time. Very important. And also, increasing the humidity in your house might boost your...
Put the humidifiers on would be a better idea. Sometimes I worry when things are moist, but in this case, higher humidity could help. It
could help because our research has shown that high humidity will allow your respiratory tract to get rid of the virus or any particle that come in through the...
When we get too dry, it's almost like the virus can
stick.
Okay.
Exactly. So, if our research applies to humans as well, this was done in mice, but it's a good idea.
But most people have humidifiers because we need them sometimes when we have cold. So you would suggest running them now. Clean them first. But
exactly. Get a filter. New filter.
What about certain foods? We've had lots of stories on Better Connecticut about drinking elderberry syrup or different things that are known to boost immune system. Taking vitamin C. Is there any vitamins or foods you recommend?
That's right. So just as any other infection, you want to boost your immune system, and the best way to do that is balanced diet, exercise. Definitely. If you can do home exercise, not go to the gym, it's even better.
That's a good question. Would you say that people really shouldn't be going to the gym that much?
If you don't have to. It's better to do it at home.
Okay.
Yeah.
And if you are going, you would recommend wiping down all the machines?
Absolutely, and washing hands as soon as possible.
Okay.
Yeah.
All right. So that's been the theme of this conversation. You really don't like any place that has more than 100 people or airports, planes, because of their circulation system.
That's right.
And again, not because people are worried that if you get the coronavirus, you're going to die, but more because the health officials like yourself on these task force who are charged with containing it is the only way to contain it is if we keep people from exposing other people.
Exactly. Because otherwise the hospitals cannot deal with the number of people who are going to come down with this
That's
virus.
the big concern. If it gets too big, we are not equipped.
Exactly. And even if you're healthy, you could be a carrier of the virus. And so in order to...
You could have no symptoms and be fine and still be spreading it.
That's right. And so you don't want to do that to the vulnerable population, which are elderly and immunocompromised.
Okay. Well, we've got, how long is recovery? I'll ask that one last question. And also, our children are scheduled for a DC class trip from Mass to DC. Should schools cancel?
Oh, I think they should cancel.
Most schools, I will say, lately, we just get more and more news releases that all schools are canceling any kind of school-sponsored trips. Now, the big question is, what will happen if college students decide to not listen and go on their pre-planned spring breaks, and then they're coming back to class after being in Europe or Mexico or on planes? Do you foresee that being a problem for the people who don't heed these warnings, and then they come back to university?
That's right. And now we cannot control what people do. All I can do is to recommend. But of course, you know, people have plans and they're going to do things that they wanted to do. And so that's something that we need to keep an eye on. Like once these students come back from their spring breaks from various different places in the world, you know, we need to be able to test people who come down with these kinds of symptoms readily.
Right. So as far as your task force, are you talking about length of time for quarantining, and are more, what's the next phase for Connecticut?
Right. So we're just sort of bracing for what's to come next, making sure that there are enough tests. That's the number one issue, is that we don't have enough tests to monitor people who have COVID-19-like diseases. So hopefully that will be resolved in the next week or so, with the more tests coming this way, hopefully. But then once that happens, then we need to have a plan for, you know, how do we quarantine sick people? I mean, do we have enough beds in the hospital? If not, what do we do about it? Do we establish a new wing in a hospital, you know, just to contain people with COVID-19? There are all these questions that come up that we're trying to do.
Plans are being made to try to figure out what would happen.
Exactly.
I mean, so far we've been lucky. It has not. We've not seen the numbers that we've seen in other states. Do you think that's because we're doing something right, or just because it hasn't? We don't have enough time yet. We're going to see many, many more cases here.
I would think so. This is the tip of the iceberg. We've just sort of begun testing for this virus. So once we test more people, I suspect we'll see more cases coming up in Connecticut. Yeah.
I know that hospitals have their own plans, but we have a lot of doctors, nurses, people who are the people who have to work at these hospitals. Two of the cases have been healthcare professionals who lived in New York City but work in Connecticut. So what's your advice for people who either have to go to a hospital because they're having a procedure done, or even if you happen to be a nurse or a doctor watching this, what's the concern?
Yeah, so I think the hospitals need to provide enough protective equipment for healthcare providers, nurses and doctors and staff. Even receptionists, you know, have to be protected from this disease, and
that would mean
like masks and gloves. Yeah,
for them because of the amount of sick people coming
in. And not just this coronavirus, but everything. Flu and other viruses as well.
Before we say goodbye to folks, and I encourage you can share this conversation. It's been very informative, and that way you can let people know what we've learned here. But do you have any final thoughts for folks?
Yes. So this virus isn't going to last forever. Okay. But right now is a critical time to be preventing spread of the virus. So if you don't have to travel, please reconsider your travel plans for, you know, the upcoming few months, and just stay home if you don't have to go anywhere. And if you have any of these conditions, definitely wash your hands and stay home as much as possible.
Dr. Akiko Iwasaki is an immunologist at Yale University. She's also on the task force that is helping prevent a greater outbreak of the coronavirus here in Connecticut. We thank you for your time, even if some of the answers aren't exactly what people want to hear about their spring break plans, but we appreciate your time. Thank you so much.
Thank you very much, Kara.
Thank you.
It's been great.